There was something about the way Mr. Armstrong walked through the door of my office that seemed to stop time for a moment. He was 68 years old, a lifetime spent working under the sun in construction in Dallas, and his body told stories of effort, calluses, and endless workdays. He was the kind of man who seemed invincible, who laughs in the face of storms, and who carries the weight of the world without complaint. But that day, as he sat in front of me, his eyes betrayed something that no hard hat, no joke with coworkers, and no steady smile could hide: fear. A quiet, deep fear that reached into his eyes and every line of his face, a fear I rarely see in my patients. In a barely audible voice, he said, "Doctor, nothing comes out anymore when," and he stopped, as if talking about it were confessing an unforgivable weakness. What I felt at that moment was not surprise, but a mix of concern and empathy, because I understood that it was not only a physical problem, but also an emotional burden he had been carrying alone for months. He told me he had been silent for nearly 6 months, worried about how his wife would react, fearing that she might think he no longer desired her or that he had stopped being useful in intimacy. He also shared everyday moments, how some nights he would go to bed without sleeping, thinking about the changes in his body and his life, and how he had avoided getting close to his partner for fear of disappointing her. His story reminded me that behind every patient is a human being with emotions, memories, habits, and little rituals that make up their daily life. Mr. Armstrong talked about his family, his adult children who were already living on their own, and how he felt increasingly disconnected, not only physically but emotionally. That day I realized I could not remain silent and that I needed to share this with more men, because what he was experiencing is more common than many think and deserves to be addressed with care, understanding, and practical solutions. Retrograde ejaculation is a concept that may sound complicated at first, but in reality it is simpler than many men imagine. Picture semen as a river with a natural channel. During climax, the body directs it outward through the urethra, which is what we know as normal ejaculation. In retrograde ejaculation, that river changes course and, instead of exiting, it flows back into the bladder. It's as if a small gate inside the body were a bit loose or misaligned, letting the flow take the easier path. This does not mean that you have lost the ability to feel pleasure or that your body has stopped working. In fact, many men still experience full orgasms, only the physical manifestation of semen does not occur in the usual way. It is important to understand that this is not a failure or a loss of masculinity, but simply a physiological variation that can happen for various reasons, such as surgeries, medications, or chronic illnesses. Visualizing it as a temporary detour can help reduce fear and anxiety about the situation. Additionally, knowing how the body works allows you to take concrete steps to improve sexual experience and maintain confidence and connection with your partner, showing that pleasure and intimacy do not depend solely on visible ejaculation. The symptoms of retrograde ejaculation are not always easy to identify at first, and many men take months to realize that something has changed. Some notice that ejaculation is much less than before, or that there is simply no visible semen at the end of climax. This can cause anxiety, worry, and even a sense of impotence, because the body seems not to respond as it used to. Other men may notice changes in their urine after sexual activity. It appears cloudy or milky, indicating that the semen has taken the path to the bladder. It is also common for sensitivity during intimacy to change. Some feel less stimulation or a softer orgasm, although pleasure can still be present. Emotionally, many experience fear of talking to their partner, shame, or even guilt, thinking they have become less desirable. Examples from patients I have seen show that these feelings are very common. At first, Mr. Armstrong avoided getting close to his wife, and Mr. Roberts felt frustrated and confused by the changes in his body. That is why it is essential to recognize these signs in time and not ignore them, because they allow identification of the cause, seeking professional help, and preventing the situation from affecting the relationship or emotional well-being. Understanding that these signs are normal and treatable can reduce anxiety and help gradually regain confidence in intimate life safely. Before continuing, I would love to know something to connect with our community. Which city or country are you watching from? Write it in the comments. I love getting to know people who genuinely care about their health, and this allows me to create content that is more useful and relevant for you and your region. Let's get straight to the point. One of the most common causes of retrograde ejaculation in men over 60 is prostate surgery. Many men, like Mr. Armstrong, must undergo procedures to treat prostate enlargement or urinary flow issues. The most common operations include transurethral resection of the prostate and laser surgeries, especially the green laser, which has become very popular due to its precision and shorter recovery time. Although these surgeries are generally safe and effective in improving urination, they can affect the nerves and muscles that control the direction of semen, particularly the internal bladder sphincter. This sphincter acts as a gate that normally closes during climax to direct semen outward. When it is affected, semen may divert to the bladder. The incidence of retrograde ejaculation after these surgeries varies according to medical studies, but it is estimated that between 50 and 70% of men who undergo laser resections experience some degree of change in ejaculation. Many patients feel concerned and fearful upon discovering that pleasure is still present, but semen no longer flows as before. That is why it is crucial for men to receive complete information before surgery, to understand that this is not a loss of masculinity or sexual ability, but a physiological change that can be managed with medical guidance, exercises, and, in some cases, specific medications. Additionally, each patient's experience is different. Some notice progressive improvement over time and with pelvic floor exercises, while others require closer follow-up and personalized adjustments in postoperative treatment. Another common cause of retrograde ejaculation in older men is medication. Many men, as they reach a certain age, take daily medication to control blood pressure, cholesterol, diabetes, or even urinary symptoms. Some drugs, although extremely helpful for general health, can have side effects on sexual function. For example, tamsulosin, commonly prescribed to improve urination in cases of prostate enlargement, relaxes the internal bladder sphincter, making it easier for semen to divert to it. Other medications that may contribute include certain antidepressants, allergy medications, beta blockers, diuretics, and drugs for prostate issues. It is very important to understand that this does not mean you should stop taking your medicine without medical supervision, because that could put your overall health at risk. The solution is to consult a doctor, review the full list of medications, and, if possible, adjust doses or replace some drugs with alternatives that maintain your well-being without affecting sexual function. Cases like Mr. Roberts are very illustrative. By carefully adjusting his medication together with his cardiologist, he began to notice gradual improvements in ejaculation without compromising his blood pressure or cardiovascular health. This shows that with professional guidance and patience, medication side effects can be managed effectively, allowing intimate life to recover partially or even significantly. Additionally, talking openly about these topics with the doctor helps reduce the anxiety and frustration that many men feel when facing changes in their bodies that they had not anticipated. Another important cause of retrograde ejaculation in older men is diabetes, especially when it is not well controlled. Diabetes can damage nerves throughout the body, a phenomenon known as diabetic neuropathy, and among these nerves are those that control ejaculation and sexual sensitivity. This means that even if the body continues to produce semen and sexual desire remains, the signal that tells the sphincter muscles to direct semen outward does not reach them properly. A very clear example is the case of Fernando, a 65-year-old man from Houston who came to my clinic concerned because his ejaculation had progressively decreased until it disappeared. Fernando also experienced tingling and numbness in his hands and feet, classic symptoms of diabetic neuropathy. His glycated hemoglobin was 10.5, far above the recommended level, confirming that his diabetes was affecting not only his overall health, but also his sexual function. After explaining the relationship between blood sugar control, nerves, and ejaculation, Fernando committed to a comprehensive change: a balanced diet, eliminating soda and excess carbohydrates, daily walks, and strict adherence to his medication. 3 months later, although his ejaculation was not the same as when he was 30, He noticed significant improvement, and most importantly, he regained confidence and a sense of control over his body. This example demonstrates that diabetes can silently affect sexual life, but with medical management, healthy habits, and patience, positive changes are possible, maintaining intimacy actively and satisfactorily. When a man notices changes in his ejaculation, it is essential to undergo a complete medical evaluation to identify the exact cause and act appropriately. This evaluation includes not only reviewing symptoms, but also a thorough analysis of medical history, current medications, and previous surgeries. During the consultation, the doctor will ask when the changes began, the frequency of episodes, whether there is pain or discomfort, and will also perform a general physical examination. One of the most revealing tests is a urine analysis after orgasm, because if semen is directed to the bladder, the urine may appear cloudy or milky, a clear sign of retrograde ejaculation. Blood tests may also be requested to evaluate testosterone levels, blood sugar control in cases of diabetes, kidney and liver function, and hormonal analyses that influence sexual function. If there was previous prostate surgery, reviewing imaging and medical reports is important to understand how the muscles and nerves involved may have been affected. This comprehensive evaluation allows the doctor not only to correctly diagnose the cause of the problem, but also to plan a personalized treatment that considers the patient's overall health, sexual needs, and quality of life. Finally, an important aspect is that this process helps men reduce anxiety and fear because understanding what is happening and why gives them control over their bodies and confidence in their intimate lives. There are different medical alternatives for managing retrograde ejaculation, and the choice depends on the underlying cause identified during evaluation. In some cases, medications are used to help strengthen the internal bladder sphincter, such as imipramine or pseudoephedrine. These drugs do not work the same for everyone, but many men report significant improvement when taken under medical supervision with carefully adjusted doses. It is important to understand that this is not an instant effect. Changes usually appear after several weeks of consistent use, and it is always crucial to maintain follow-up to adjust the dose and avoid side effects. In addition to medication, some men benefit from combined treatments that include hormone therapy if low testosterone is detected, or minimally invasive interventions in cases related to previous prostate surgeries. There are also very specific surgical options, but these are generally reserved for situations where other treatments have not been effective and always after a detailed assessment of risks and benefits. The most important thing is that these medical options allow partial recovery of sexual function and improvement in intimate life, restoring confidence and security. Many patients, seeing that there are concrete and personalized solutions, experience immediate psychological relief, reducing the anxiety, fear, and frustration that normally accompany this problem. In short, medicine offers effective tools, but success depends on patience, consistency, and constant communication with the healthcare professional. Strengthening the pelvic floor muscles, known as the pubococcygeal muscles, can make a big difference in retrograde ejaculation and sexual health in general. Kegel exercises are the most well-known and effective tool. They consist of contracting and relaxing the muscles you would use to stop the flow of urine. It is recommended to start with short sessions of 10 repetitions, 3 times a day, gradually increasing as the muscles strengthen. In addition to helping improve strength and control during ejaculation, these exercises also provide additional benefits, such as better bladder control, improved blood circulation in the pelvic area, and a general feeling of well-being. Some men find it helpful to do these exercises while sitting, others standing, and even lying down. The key is consistency and paying attention to breathing, avoiding tensing the abdominal or gluteal muscles. For many, integrating these exercises into the daily routine can be a small but very powerful change, especially when combined with deep breathing and relaxation techniques, which help reduce stress and anxiety related to sexual activity. Motivation is fundamental because results are not immediate, but with patience and discipline, muscle strengthening contributes to regaining confidence, a sense of control, and overall a more satisfying and pleasurable intimate life. Lifestyle changes are fundamental to improving sexual health and specifically managing retrograde ejaculation. Although often underestimated, factors such as diet, physical activity, alcohol and tobacco use, and stress management have a direct impact on sexual function. Eating a balanced diet, including fruits, vegetables, lean proteins, and healthy fats, not only helps control weight but also improves blood circulation, which is essential for sexual response. Regular exercise, whether walking, swimming, or doing resistance training, strengthens the cardiovascular system and helps keep nerves and muscles active. On the other hand, excessive alcohol consumption can impair sexual function and reduce energy, while smoking affects circulation and the nervous system, increasing the risk of erectile problems and retrograde ejaculation. Additionally, learning to manage stress through breathing techniques, meditation, or recreational activities not only improves mental health, but also reduces muscle tension and enhances sexual response. Fernando, one of my patients, started walking 30 minutes a day, cut back on alcohol, and added more vegetables to his meals. After 3 months, he noticed significant improvements not only in his daily energy, but also in his intimate life. The key is to adopt sustainable habits, integrate them into the daily routine, and understand that every small change contributes to overall well-being, strengthening not only physical health, but also confidence and connection with the partner. Open communication with the partner is a fundamental pillar for facing retrograde ejaculation. Many men feel ashamed or afraid of being judged, thinking that their partner will see them negatively, but in reality, most women value honesty and trust more than physical perfection. Talking about the issue can relieve anxiety and strengthen the relationship. For example, Mr. Armstrong took weeks to share his concerns with his wife, fearing her reaction, but when he finally did, she responded with understanding and relief, sharing that she had also been afraid of losing closeness with him. It is helpful to start the conversation at a calm moment, without rushing, expressing personal feelings, and avoiding blame. You can say something like, "I want to tell you something that worries me because our relationship is important to me, and I need your support," which opens the door to sincere dialogue. Many couples discover that intimacy is not limited to sexual activity, but expands through daily gestures of affection, attention, and companionship, reinforcing emotional connection. Additionally, maintaining regular communication helps detect changes or problems early, allowing solutions to be sought together without fear. The trust generated when both speak openly and honestly is as powerful a resource as any medical treatment. It calms anxiety, strengthens complicity, and turns challenges into opportunities to grow as a couple. Testosterone is a key hormone in male sexuality, but it is not always the cause of retrograde ejaculation. Many men ask if they need supplements, and the answer depends on a complete medical evaluation. Testosterone influences sexual desire, energy, and mood, but it does not automatically guarantee normal ejaculation. Measuring it is simple. A blood test in the morning, when levels are highest, can give a clear picture. If results show low levels, treatments may include injections, gels, or patches, always under medical supervision. However, it is crucial to understand that testosterone is not a magic solution. It is only part of an integral treatment that includes lifestyle changes, exercises, and communication with the partner. Additionally, excess testosterone can cause side effects such as acne, irritability, sleep problems, or increased cardiovascular risk, making professional supervision essential. Some men find that with small adjustments, such as improving sleep, reducing stress, and maintaining regular physical activity, hormone levels normalize without supplementation. It is useful to think of testosterone as an engine that drives many body functions. If the engine is in good condition, everything works better, but if we try to accelerate without maintaining it, problems can worsen. Understanding this helps men make informed decisions and feel more at ease with the changes they experience, avoiding unnecessary worry and promoting a positive approach to sexual health. It is important for men to understand that achieving a complete cure for retrograde ejaculation is not always possible, and this does not mean that sexual life is doomed. Accepting realistic expectations helps reduce anxiety and improve the intimate experience. For example, some men may recover only partial normal ejaculation, while others may need alternative methods to maintain fertility, such as semen collection. What matters is enjoying physical contact, emotional intimacy, and communication with the partner, redefining masculinity in a broader way that does not rely exclusively on ejaculation. Additionally, understanding that sexual satisfaction is not measured solely by the final act allows appreciation of other aspects of the relationship: caresses, foreplay, emotional closeness, and mutual enjoyment. Men like Mr. Armstrong or Fernando have learned that by adjusting expectations and focusing on shared pleasure, pressure decreases and sexual life becomes richer and more satisfying. The key is to integrate medical information, open communication, and patience with oneself, creating a path where personal acceptance and creativity in intimacy become allies for maintaining a full and rewarding sexuality. Talking about retrograde ejaculation remains a taboo topic for many men, but knowing the statistics helps normalize the situation and reduce anxiety. Recent studies indicate that between 5 and 10% of men who have had prostate surgery experience some degree of retrograde ejaculation, and among those taking certain medications, this percentage may be similar. Although the numbers may seem small, they represent thousands of men living experiences similar to those of Mr. Armstrong or Fernando. Understanding that they are not alone allows them to share experiences, seek support, and consult doctors without feeling ashamed. Furthermore, the data shows that most men who adopt treatments and lifestyle changes experience significant improvements, reinforcing the importance of acting proactively. Normalizing this condition also helps break myths and reduce psychological stress. Retrograde ejaculation does not decrease desire or the ability to enjoy intimacy, and recognizing this opens the door to more open, honest, and satisfying relationships. Knowing the statistics and testimonials of other men turns an experience that might seem isolated into a common and treatable phenomenon, fostering confidence and empowerment. Although retrograde ejaculation can make natural conception more difficult, there are multiple alternatives that allow men to maintain fertility and achieve the dream of becoming a father. One of the most common options is laboratory semen collection, a simple procedure that allows sperm to be recovered directly from the bladder after ejaculation. These sperm can be used in assisted reproductive techniques such as artificial insemination or in vitro fertilization, significantly increasing the chances of conception. Additionally, some specific medications can help improve normal ejaculation, depending on the cause, while exercises and lifestyle changes also contribute to optimizing sexual function and semen quality. It is important for each man to consult a fertility specialist to evaluate the best strategy, taking into account factors such as age, overall health, and medical history. Cases like Fernando's show that even with retrograde ejaculation, planning, and medical support can successfully achieve the goal of becoming a father. The key is not to get discouraged, to seek reliable information, and to maintain a positive attitude, understanding that fertility can be preserved and adapted through modern and safe medical options. Mr. Armstrong, after years of worrying about his retrograde ejaculation, was able to transform his experience through a comprehensive approach that combined medical care, exercises, and open communication with his partner. At first, frustration and uncertainty affected him emotionally. He felt that something in his masculinity was failing, but with professional guidance, he discovered that the condition did not define his value or his ability to enjoy intimacy. Similarly, Mr. Roberts, after a complicated prostate surgery, experienced significant changes in his sexuality. At first, the adjustment was difficult and caused anxiety, but with patience and the use of muscle-strengthening exercises and relaxation techniques, he regained confidence and improved his sexual life. Meanwhile, Fernando, who had diabetes and neuropathy, faced a different challenge. Glucose control and constant health monitoring were essential to recover sexual function and maintain fertility. Each of these cases demonstrates that, although retrograde ejaculation can cause moments of frustration and anxiety, a combination of medical treatment, psychological support, healthy habits, and communication with the partner can help overcome difficulties. These stories also highlight the importance of resilience and perseverance. With the right attitude and professional support, it is possible to enjoy satisfying sexual relationships, maintain fertility, and regain self-esteem, showing that every man can write his own success story. To manage retrograde ejaculation effectively, it is essential to follow a series of practical steps that combine medical care and healthy habits. First, it is recommended to prepare for the medical appointment in advance by noting all questions, symptoms, and changes observed in sexual function, as well as information about medications and health history. During the consultation, it is important to be honest and detailed so that the professional can perform an accurate evaluation, which may include blood tests, urine studies, and specific physical examinations. Once the cause is identified, ongoing follow-up is essential, keeping regular appointments, reporting any side effects from treatments, and adjusting routines according to medical guidance. Consistency in performing muscle-strengthening exercises and making lifestyle changes, such as improving diet, reducing alcohol and tobacco, managing stress, and engaging in daily physical activity, enhances results and improves personal confidence. It is also advisable to keep a record of progress, both physical and emotional, to monitor development and stay motivated. Finally, maintaining open communication with the partner about progress, difficulties, and expectations helps reinforce mutual support, creating an environment of understanding and collaboration that facilitates recovery and overall well-being. Overcoming retrograde ejaculation is not only about addressing a physical aspect of sexual health, but also about recognizing personal value and the ability to adapt to challenges. Every step you take, from consulting a specialist to implementing lifestyle changes, is an act of self-care and empowerment. It is normal to feel fear, shame, or frustration at first, but these emotions do not define your masculinity or your ability to enjoy intimacy. Stories like those of Mr. Armstrong, Mr. Roberts, and Fernando demonstrate that with patience, consistency, and support, it is possible to regain confidence, improve sexual quality of life, and strengthen the relationship with your partner. Remember that seeking medical help and communicating openly is not a sign of weakness, but of responsibility and self-respect. Every small progress, a change in routine, a session of exercises, a sincere conversation with the partner adds up and builds a sense of control and well-being. Celebrate these achievements and use the available information and resources to make informed decisions about your health. Acting promptly, staying informed, and maintaining consistency are steps that strengthen both body and mind, positively impacting self-esteem and the relationship with your partner. Finally, this process is an opportunity to redefine masculinity in a positive way, based on self-care, communication, and resilience. Never underestimate the power of your determination. Every action you take today is a step toward a fuller sexual life, greater personal confidence, and a future full of assurance. You have the ability to act, seek solutions, and transform this experience into a path of growth and overall well-being.